There will be more, I'm sure, but I think maybe it's a good time to start now. So welcome to everybody to this second of the veterinary CPD events run by the faculty. Although this comes under the banner of veterinary, because our main speaker is a vet, it's of course vital interest to doctors as well. And you'll be aware that what Petra is going to talk about includes human homeopathy. So we also have a colleague, Thomas Peinbauer, joining us on the seminar as a medical for some medical input if necessary. So first of all, I'd like to welcome everybody to the faculty itself, and welcome particularly to Gary Smith, our president, and Helen Beaumont, our medical dean, and lots of familiar faces there from the faculty. A lot of people, newcomers as well, so you're very welcome. I'd like to, first of all, thank our sponsors as well, which is an essential thing to do. Our sponsors for this event are Freemans Pharmacy and Saltire Books, aka Lee Kane and Stephen Kane, who've been supporters of the faculty and of veterinary homeopathy for many years. We have close relationships with more than one homeopathic pharmacy in the UK, and certainly the support we get from Lee and Stephen is wonderful. And I would have to point out as well that Freemans Pharmacy have the only 6 registered veterinary homeopathic medicines that are available. When the EU changed brought the rules out for registration of homeopathic medicines, they were very early into the issue and went through the registration process for 6 veterinary homeopathic medicines. So when people say that they aren't registered, we do actually have 6 remedies which are registered. So we're very grateful for that. Lee also was, Lee and Stephen were also very generous when agreeing to sponsor this in presenting us with a selection of books, of 3 books, veterinary books. I wasn't, to be honest, quite sure whether we could run a raffle. So in fact, what we've elected to do is to give those to the best 3 cases for the students who are about to take the LF Hom Vet exam. They have to put 3 cases in. So the best 3 cases will get the 3 books, which is a very nice prize. There's the Homeopathy for Horses by my colleague Tim Cousins. There's the Veterinary Repertory, which was created by the late Jack Hoare, whom we sadly miss now. And last but not least, there's my book, Insights into Veterinary Homeopathy. So a very nice prize. It's well worth putting some extra work into your case histories, students. Thank you. Petra is well known to a lot of us in the veterinary homeopathic field, particularly through her IAVH. Her work for the IAVH. We first met actually in 2011 at the BAHVS conference in the Peak District. But we've had a lot of work to do over the years with the IAVH. As with Edward, with our last CPD event, I have a shortened CV here for Petra, but it's such an interesting story as well. I'm going to take up just a couple of minutes letting you know how she came to be where she is now. She graduated with a doctorate at the University of Veterinary Medicine in Vienna in 2007, did an equine internship. She worked in equine practice for a few years and then opened her own veterinary practice in 2012. She achieved the European Academy of Veterinary Homeopathy diploma in 2009, and then another 5 years training as a specialist veterinarian for homeopathy of the Austrian Veterinary Association. She became a clinical expert to the Austrian Agency for Health and Food Security, and is presently head of the research section of WISHOM, which is the German Society for Scientific Homeopathy. She's currently president of the ÖGVH, the Austrian Society for Veterinary Homeopathy, and she served for 3 years as General Secretary of the IAVH. She's lectured on veterinary homeopathy around the world, and in recent years she's focused on the role of homeopathy in addressing antibiotic resistance. She's presented to various symposia, including the World Veterinary Congress in Spain, the World Integrated Medicine Forum in India, an ECH IAVH symposium in Bulgaria, and the WISHOM ICE Congress in Germany, presenting the importance of homeopathy in the fight against antibiotic resistance. She had a case report published in the Journal of Equine Veterinary Science, which she's going to relate to us today. And of course, the reason she's here is that in 2020, she co-authored the review on evidence-based homeopathy and its potential to help reduce antimicrobial resistance. This was co-authored by Thomas Peinbauer, who, as I mentioned, joined us. Thomas is in private practice for homeopathy, has been so for the last 20 years. And he is president of the European Committee for Homeopathy. He's a lecturer for general medicine and complementary medicine at the University of Linz in Austria. And he's a member of the Austrian Society of General Medicine and German Network of Evidence-Based Medicine. So another very qualified participant. We're very welcome here, Thomas. There were 2 other authors of the work that Petra is going to show. One is Elizabeth Ellinger, who is a vet, who is another member of the IAVH and has done quite a lot of work already. And Michael Frass, who is a doctor, a homeopathic doctor of well-renowned, certainly in the medical homeopathy field. So that's enough from me, enough introduction, I think. Welcome, Petra. So over to you.
Thank you very much, Peter, for this kind introduction and the kind invitation. And just trying to, now, there we are. And welcome to everybody. It's really an honor to me to be invited by the Faculty of Homeopathy to speak about the potential role of homeopathy within the antimicrobial resistance problem. Yeah, so I just want to start with the forward-looking goals of integrative veterinary and human medicine. It's all about tolerance and broadening of perspectives which serves patients. So integrative medicine is the best practice combination of conventional and complementary medicine. We all have to do scientifically sound work, so research in and use of homeopathic medicine is in accordance with the One Health approach to human, animal, and environmental health. There is only one health of all of us, of humans, animals, and the environment. We all are causally interconnected, and consequently, we all need evidence-based integrative veterinary and human medicine. I think we all are aware about the evidence pyramid. I will be speaking about meta-analysis and systematic reviews on randomized controlled trials, which are experimental studies with high internal validity to be sure that in case effectiveness is shown of a medication, it's due to this medication and not due to other reasons. But on the other hand, we need observational studies with high external validity to be sure that we also can examine the work, the effect of the medication in our daily practice patient. Because the daily practice patient often does not correspond to the patients from the studies, from the experimental studies. So medicine in general needs experimental studies on the one hand and observational studies on the other hand. For complementary medicine, including homeopathy, we can say that we have really good results within the observational studies, real-world data, so to say, but we also have good results within experimental studies. If we speak about evidence-based medicine, we must be aware about the definition given by David Sackett, the founder of modern evidence-based medicine. It is based on 3 pillars. It's our clinical experience, the values and wishes of the patients, respectively clients, and the current state of research. You can see in the picture at the right side that we have 3 overlapping areas, and where they overlap, it's evidence-based medicine. I also want to compare that the house of evidence-based medicine is based on 3 pillars. It can't stand just on 1 pillar. I'm proud to be able to present our narrative review with the title Evidence-Based Homeopathy and Veterinary Homeopathy and its Potential to Help Overcome the Antimicrobial Resistance Problem, an Overview, which was published last year in October in a conventional peer-reviewed journal, the Swiss Archives on Veterinary Medicines. And we, as a team, in the sense of One Health, prepared this review together. It's 2 human physicians, Professor Michael Frass and Dr. Thomas Beinbauer, from 2 different Austrian universities, and 2 veterinarians, Dr. Lisbeth Ellinger from the Netherlands and myself. So what does the WHO say about One Health? It is an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes. The areas of work in which a One Health approach is particularly relevant include food safety, the control of zoonosis, and combating antibiotic resistance. Many of the same microbes infect animals and humans as they share the ecosystems they live in. Efforts by just one sector cannot prevent or eliminate the problem. Drug-resistant microbes can be transmitted between animals and humans through direct contact or through contaminated food. So to effectively contain it, a well-coordinated approach in humans and in animals is required. So we need people who protect human, animal, and environmental health and other partners to coordinate, communicate, and collaborate to achieve the best health outcomes for people, animals, plants, and our environment. So to come back to our review, we found out that there are 3 main messages. Evidence is available for the effectiveness of human and veterinary homeopathy in general, and in particular, for homeopathic treatments of infections. For individualized homeopathy, there are effects on all quality levels according to Cochrane criteria recognizable, also in the methodologically high-quality studies. So the next necessary step are further studies in cooperation with universities, and for this it needs better integration into the curriculum of the universities, according to the Swiss model, which means that complementary medicine, including homeopathy, is part of the obligatory model, so that every student knows what complementary medicine is, how it works, and where it can be used. We did a differentiated clarification of the evidence base according to a described methodology. So meta-analysis and systematic reviews covering different indications and then different homeopathic methodologies were summarized according to a literature and database search until August 2019. And we used the following search strategy. We searched for the term homeopath and article type meta-analysis and article type systematic review. In addition to this, we did an evidence-based critique of the approach used in the second Australian National Health and Medical Research Council report and in the European Academy's Signed Advisory Council statement. This review is one of the foundations for cooperation with universities in Austria, Germany, Switzerland, and other countries regarding research projects to evaluate the potential of homeopathy and phytotherapy to achieve reduction in antibiotic use. Because we have to meet the demands of the European Green Deal, the Farm to Fork strategy, and especially the EU organic farming regulation. The demands are to reduce antibiotic use by 50% across the EU by 2030, to increase the number of organic farms in the EU from 8 to 25% by 2030, and especially to give preference to homeopathy and phytotherapy on organic farms before using conventional medicines, including antibiotics. So it's a legal request that homeopathy is used first in our patients on organic farms. And we have to fulfill this legal request. So application of complementary medical disciplines in the sense of integrative veterinary medicine is forward-looking. I think we all agree on this. And current national laws in Switzerland, Austria, Germany, and the UK, and the EU legislation guarantee the quality and safety of homeopathic medicinal products, as well as a safe legatus practice of homeopathic medicine. For human homeopathic medicine, there is a CEN standard. Thomas might speak about this a little bit later. Evidence for the effectiveness of human and veterinary homeopathy in general and specifically in the treatment of infections is sufficient to warrant further research in this area. 5 of the 6 meta-analyses by 2014 on different indications concluded that the effectiveness of homeopathic therapy is significantly different from placebo. We choose the year 2014 because until this year, studies could have been considered in the second Australian NHMRC report and in the ASAC statement, but many of them were not, especially the positive ones, and there were no reasons given why they were not included. There is definitely an urgent need for further methodologically high-quality studies in human as well as in veterinary homeopathy. And the global threat posed by the problem of antimicrobial resistance makes this particularly important. And for the quality assurance of further studies, their implementation at university institutions is a prerequisite. And this can only become possible through the better integration of complementary medicine, including homeopathy, at universities. Because universities need to play a major role in upholding high quality research and teaching that will benefit patients. It's very interesting to know that the integration is already asserted by the American Consensus Guideline on University Continuing Education in Integrative Veterinary Medicine. And it is legally ensured in Switzerland according to the Medical Profession Act for teaching and research at the university. So these are really good arguments in case you are speaking with people from universities. Our review is available open access, and I'm proud that it might be now possible to do a translation in English, because the Faculty of Homeopathy offered to do this, and the journal, the Swiss Archives on Veterinary Medicine, offered to publish it. And we found a sponsor, an Austrian pharmacy producing homeopathic medicines. It's called HomeoCure, who will give us the money to do the layouting and to pay the layouting by the journal. So hopefully soon we will have an English translation of our review. To go into more detail, prior to the publication of the second Australian NHMRC report, there were 5 systematic reviews with meta-analyses published on various indications and all homeopathic methodologies. 4 of them were positive for homeopathy. So we had or have 4 green dots and just 1 red one. So the majority, at least to me, is green. There you can see the 5 systematic reviews. The first one was published by Kleinen et al. In 1991. It included 107 trials and analyzed 105, and the global result was positive. Linde, published in 1997, included 119 trials, analyzed 89, and the global result was positive. Then in 2000, Cougerat et al. Published and included 118 trials, analyzed only 17 because they considered only those studies with an objective endpoint, and the global result was positive. In 2005, Zhang et al. Published their systematic review, and they initially planned to include 110 trials on homeopathy and compare them with 110 matched trials on conventional medicine. But then they decided to reduce the studies to 8 homeopathy trials and 6 studies on conventional medicine. The matching was no longer considered, and so they reduced 93% of the studies. The global result was negative. It's interesting to know that about 20 homeopathy trials were of high quality, and only about 10 trials on conventional medicine were of high quality. Other authors then did an analysis of the high quality trials and find for these high quality trials a positive result. Further to this, Zhang et al. Did not do a sensitivity analysis. Other authors did the sensitivity analysis and could not confirm the negative outcome of this study. In 2014, Messi et al. Included in their systematic review 32 trials on individualized homeopathy and analyzed 22, and the global result was positive. They did a whole review program, so it was 4 systematic reviews with meta-analysis. 2 of them were on individualized homeopathy compared with placebo and compared with other than placebo, and 2 on non-individualized homeopathy compared with placebo and compared with other than placebo. And for individualized homeopathy, effects are detectable at all quality levels according to Cochrane criteria, also in methodologically high quality studies. And this was published in a conventional peer-reviewed journal called Systematic Review. The 4 meta-analyses include 131 original papers, 13 randomized controlled trials are of minimal bias risk. 5 out of the 13 are of high reliable evidence. 10 out of the 13 compare homeopathy versus placebo. The odds ratio, so the effect size, is 1.68. Confidence interval does not include 1, so there is a statistically significant difference. If we now have a closer look at the systematic review of Matthew et al. In 2014 on individualized homeopathy compared with placebo, we see that the odds ratio of the 22 randomized controlled trials with extractable evidence is 1.53, and the odds ratio of the 3 randomized controlled trials with reliable evidence, it's 1.98. Both confidence intervals do not include 1, so there is statistically significant difference, and the positive outcome was confirmed by sensitivity analysis. So it is to say that people in the homeopathy group have a chance which is 1.5 to 2 times higher to experience an effect compared with the placebo group. There you can see all studies, and you can see the ones marked with a B. These are the ones with reliable evidence. There you can see the funnel plot. The vertical line is the odds ratio. The dots are the studies, and you can see there are studies, small studies and large studies with small and large treatment effects. The dots are well distributed at both sides, left side and right side from the odds ratio. So publication bias is not to be assumed. And there you see the forest plot. In the first line, the odds ratio of all studies. In the last line, the odds ratio of the reliable studies. And you see that all confidence intervals do not include 1. So when it comes to veterinary homeopathy, we have to say that we have just one systematic review and meta-analysis where homeopathy is compared with placebo. There is limited evidence for effectiveness of veterinary homeopathy versus placebo. The pooled odds ratio is 1.69. Confidence interval does not include 1, so there is a statistically significant difference between homeopathy and placebo in favor of homeopathy. So where's the problem? It's only the systematic review from 2005, the second Australian NHMRC report, and the ASAC statement, which show no effectiveness of homeopathy beyond placebo. All those 3 articles exclude more than 90% of the studies. Fact is that more than 90% of all studies have to be excluded in order to show homeopathy as ineffective. This is what already in 2013 Robert Hahn found in his review, and he is professor for anesthesiology and no homeopath. I think we all agree that quality assurance must be granted by adherence to the criteria of evidence-based medicine. So we have to work in compliance with scientific standards, such as consideration of all high-quality studies of evidence class 1A and 1B, because arbitrary and scientifically unsupportable reduction of studies led to negative results. This is what several authors found out, and the 3 examples are the review from 2005, the second Australian NHMRC report, and both are, together with other studies, the base of the ASAC statement. If there is a second Australian NHMRC report, there must be a first one as well. The first one was already written in 2012. It was authored by Professor Karen Grimmer, and it was hidden from the public until 2019. Only due to high public pressure, it was then published in 2019, and it showed promising evidence of effectiveness of homeopathy in 5 indications: two of them with high relevance to the antimicrobial resistance issue, namely upper respiratory tract infections and otitis media. So one has to question why it was hidden from the public. This is one table of our review. There's much information, but I want to focus on the ASAC statement. If you remember the evidence pyramid, you might remember that at the base, it says expert opinion. So it's evidence class 5. And so it's no systematic review. There are no inclusion or exclusion criteria defined which studies to analyze within the ASAC statement. They did not explain why they did not include, for example, the systematic review of Matthew et al. From 2014. We did never get an answer on this question. And the base was, for example, the review of Shank, as well as the second Australian NHMRC report. We've been already speaking about the review of Shank, where 93% of the studies were excluded. And within the second Australian NHMRC report, which is a systematic review, but it was not published in a peer-reviewed journal, out of 176 studies, only 5 were considered. Inclusion criteria were that at least 150 study participants were needed, and the JEDET score needed to be 5 out of 5. Both criteria were not used in any other systematic review conducted by the NHMRC. Further to this, Cochrane, so the institution for analysis of evidence, does not use the number of study participants as an inclusion criterion. Finally, the second Australian NHMRC report excluded 97% of the studies. So, to come to a conclusion, the second Australian NHMRC report with very unusual, intentionally chosen inclusion criteria, and the ASAC statement with very selective references. In both cases, evaluation is not done according to the criteria of evidence-based medicine. When we want to compare evidence on conventional therapies with evidence on homeopathy, we have to have a look at a systematic review of 1,016 Cochrane reviews of conventional therapies. 44% had a positive outcome, 7% had a negative outcome, and in 49%, neither benefit nor harm could be shown. For 96%, more research was requested. And the 44% consist of 1% where effectiveness could be shown without any doubt. And in 43%, there were methodological weaknesses. So effectiveness could not be shown without doubt. This is the reason why further research is required. If we compare it now with the effectiveness of homeopathy and the evidence of homeopathy, we can say that homeopathy falls within the 44% with positive outcome, and more research is required. But for this statement, it needs that we do an analysis of the evidence on conventional therapies and on homeopathy in an objective way and use the same measures. So now I want to speak about the potential of integrative medicine in antimicrobial resistance. Already in 2017-18, in the framework of the 4th Joint Programming Initiative on Antimicrobial Resistance, there was a European working group consisting of medical scientists from 5 European countries on appropriate use of antibiotics, the role of chem treatment strategies. Preliminary studies have already shown that contributions of integrative medical practices and hospitals are promising. They have lower antibiotic prescribing rates and lower resistance rates compared to conventional practices. This research team did a review on integrative medicine and antimicrobial resistance, which was published in 2019. And they showed that the potential of integrative medicine, including homeopathy, to reduce antibiotic use is evident. And they emphasized the need for further research. Currently, in the context of the 10th Joint Programming Initiative on Antimicrobial Resistance, there are human and veterinary physicians, as well as experts in biology and pharmacists and several people more, are integrated in one project in the sense of One Health. It's an international project called Network Traditional and Complementary Medical Alternatives for Antibiotics Worldwide, Global Initiative for Traditional Solutions to Antimicrobial Resistance. I'm proud to be part of this group together with Professor Michael Frass and many other researchers from different universities all over the world. If you want to know more about this, please have a look at the links. But all this started several years ago. Dr. Thomas Peinbauer, while he was president of the European Committee for Homeopathy, worked together with Eurochem, and they initiated a CHEM interested group meeting, which was hosted by the member of the European Parliament, Sirpa Pietikäinen from Finland, and Aleš Peterle from Slovenia. And the topic was complementary and alternative medicine and reducing the need for antibiotics. There were several speakers on the different complementary medical disciplines, and already there, Professor Michael Frass and Dr. Lisbeth Ellinger were talking about homeopathy as an alternative to antibiotics in human and animal medicine. Michael Frass published a study in 2005, a randomized double-blind placebo-controlled trial in an intensive care unit on adjunctive homeopathic treatment in patients with severe sepsis. Already in this time, but still now, mortality in patients with severe sepsis remains high despite the development of several therapeutic strategies. So the aim of this study was to evaluate whether homeopathy is able to influence long-term outcome in critically ill patients suffering from severe sepsis. There were 70 patients with severe sepsis who received homeopathic treatment or placebo. 5 globules in a potency of 200 C were given at a 12-hour interval during the stay at the intensive care unit. Survival after 30 and 180 days was recorded. And it's important to say that homeopathy was given in addition to standard therapy. And at day 180, the survival rate in the homeopathically treated group was statistically significantly higher than in the placebo group, in the per protocol analysis as well as in the intention to treat analysis. You might already know the study of Dr. Lisbeth Ellinger, titled Homeopathy as Replacement to Antibiotics in the Case of Escherichia coli Diarrhea in Neonatal Piglets. And I want to emphasize one sentence, namely the use of antibiotics in the livestock sector is increasing to such an extent that it threatens negative consequences for human health, animal health, and the environment. And she said this already in 2010. On a commercial pig farm, 52 sows of different varieties in their last month of gestation were treated twice a week with either the homeopathic agent Coli 30K or placebo. and the 525 piglets born from these sows were scored for occurrence and duration of diarrhea. So mother sows received a homeopathic medicinal product or placebo, and piglets were evaluated. And the homeopathic group showed significantly fewer piglets with diarrhea. The severity of the disease seems to be decreased, and with diarrhea of shorter duration. So you might say that this study is triple blinded because mother sows were treated and piglets did not know anything about the homeopathic treatment. There is a systematic review from 2019. 32 studies on core mastitis from 1982 to 2016 were analyzed by a quality score. And for the first time in veterinary homeopathy, it was considered if individualized homeopathy was performed. 8 studies show a quality score of 2.5 or higher than 2.5 out of 5. And these high quality studies indicate effectiveness of homeopathy. One study also shows reduction of antibiotic use up to 75%. So I just want to say that we now go from experimental studies, so evidence class 1, to observational studies, so evidence class 2. Another study from 2019 on the Cometium project in Switzerland showed that with complementary medicine, especially homeopathic care, farm antibiotic treatment incidence significantly decreased from 27 to 18 treatments per 100 animals in the first year. So it's a decrease of 33%. Also, an epidemiological study on animal health in pig farms with special reference to management factors in the use of antibiotics and homeopathic medicinal products, which was conducted at the Veterinary School of Hanover in Germany, showed that more use of homeopathy is associated with higher herd health score, less antibiotic use, better animal performance, greater herd health, and farmers said that using homeopathy effectively is difficult for them without veterinary support. This is what farmers say, but it's also shown in several studies in the last years in different countries, in Germany, in Spain, in many different countries. And so it's the veterinary profession has duty to be part of the movement towards integrative medicine. And we have to promote the proper training of veterinary surgeons in homeopathy, especially because of the legal request of using homeopathy first in organic farms by EU organic farming regulation. This is another table of our review, loads of information. At the left side, you can see that we included in this table studies of evidence class 1 and class 2, and on veterinary and human homeopathy. And it's a selection of literature as representative as possible on the contribution of homeopathy to the problem of antimicrobial resistance. At the right side, you see the outcome, and you see many positive outcomes, but also some negative ones. And I want to focus now on a randomized controlled trial, which was published in Veterinary Record, performed in mastitis in cattle with a negative outcome. And you can see in the column titled Homeopathic Principles Applied that in these studies, homeopathic principles were not applied. This study was funded by the EU. It was part of the so-called IMPRO project, and unfortunately, the research team refused any support offered by experts in homeopathy. They even refused the help or support by different professors from different universities. And so it's kind of logic that there is a negative outcome. I want to compare with conventional medicine. If a specialist in internal medicine performs a difficult surgery instead of a surgeon, the effect is unlikely. If a veterinarian without training in homeopathy selects the homeopathic medicine a product, effectiveness is unlikely. Further to this, it's not according to scientific standards that the research team does not consist of experts of the topic which is searched or research is done in. So to compare with conventional medicine, if there is a study done on surgeries, surgeons are for sure included in the research team. And the same is needed for studies in homeopathy. So what are now our projects we are working on? On the one hand, we are doing observational studies. The first step is the creation of the framework conditions for data collection on homeopathic treatment in farm animal practice. So we have to do a so-called feasibility study. And I'm proud to be able to say that we have 3 universities and research institutes for organic farming participating in our research project from 3 German-speaking countries. And we would be happy if we could, or if you are interested, joining our research team, and if there are several other universities who want to join our research team. It needs additional labeling of homeopathic, phytotherapeutic, and conventional treatments to enable data evaluation on potential of homeopathy and phytotherapy to reduce antibiotic use. And again, in the sense of One Health, it's 2 human doctors and 2 veterinarians who developed a study protocol for this retrospective cohort study. Based on the outcome of this retrospective cohort study, we want to do a multi-center prospective observational study for the moment in the 3 German-speaking countries. The aim is survey of the potential of homeopathy and phytotherapy to reduce antibiotic use. And in case there is a positive outcome, we want to transfer the measures, so the homeopathic and phytotherapeutic therapies, also to conventional farms. And regarding evidence class 1 studies, we want to do a replication of the piglet study I've presented before. We want to do a randomized placebo-controlled double-blind study in enterotoxic E. coli related weaning diarrhea. Because of the Animal Welfare Act, at least in Austria, it's not allowed to do a completely identical replication of a study. So we need to switch the study population from neonatal piglets to piglets post-weaning. They have the same problem with enterotoxic E. coli diarrhea. We are looking for a farm without antibiotic and zinc use at weaning and with physically separated pens. And we need about 145 weaned piglets after dropout if we can do it in 1 weaning group. So if you are aware of such a farm, please get in contact with me.
Petra, thank you.
Thank you very much, Peter. Yeah, I know it's very concise, and yeah, I think we can talk about this a little bit later in the question and answer session. Now I want to start with my case report. Yeah, there we are. And yeah, I want to ask you or invite you, if you are interested, we can do an evaluation of my case report at the end. And yeah, I will come to this a little bit later, but now the first report, the case report on a wound healing disorder in a horse associated with antimicrobial-resistant bacteria resolved with homeopathic medicine. And as Peter already said, it was presented at the World Veterinary Congress, and it was published in a conventional peer-reviewed journal, Equine Veterinary Science Journal. I think it's really important that we try to publish our case reports, our studies in conventional journals in order to inform our colleagues about what is possible with homeopathy. It's a 4-year-old trotter gelding. He had a wound healing disorder post-surgery associated with antimicrobial-resistant bacteria. He failed to respond to antibiotic therapy with gentamicin and penicillin, was then switched to sulfadiazine, sodium, and trimethoprim. The bacteriological examination of a deep wound swab showed oxacillin-resistant Staphylococcus hemolyticus and Actinobacillus E. coli. And then I did an individualized homeopathic therapy. The horse owner asked for a complementary medical treatment due to the treatment failure and for sure due to the existence of oxacillin-resistant Staphylococcus. And for sure the horse owner was informed about complications, including potentially lethal septicemia. And I used this case for the case report because its conventional therapy corresponds to the current state of the art. And the horse was treated in a renowned equine clinic. At the left side, you see the picture 2 hours after the accident has happened. And at the right side, you see the picture after surgical treatment. Further to surgical care, the horse received 500 mg of amikacin intra-articularly, and the horse was put on gentamicin and penicillin, as well as flunixin, meglumine, and omeprazole. Due to the treatment failure, on the 29th of June, the horse was switched from gentamicin and penicillin to sulfadiazine, natrium, and trimethoprim. And the day after the bacteriological examination results were received, it was a MAC-A positive, TSST negative, and PVL negative oxacillin-resistant Staphylococcus hemolyticus and Actinobacillus E. coli. You can see it there at the bacterial examination result together with the sensitivity test. And you see there are a lot of R's for resistant, and there is no antibiotic left, which is authorized for use in horses. So this is the picture 2 weeks after surgical treatment. You see the seroma, the edema, also at the ventral chest, and the necrosis. This was the time when the horse owner decided to take the horse home and off medication. And she waited another 6 more days until she called me because the horse became lame just the day she called me. And the horse showed a purulent inflammation, still edema and seroma, and the lameness at walk. The wound edges were moderately hardened. The wound secretion was mild, thick, yellow, purulent. And the horse was of a very sensitive, careful, and considerate character. I did a full anamnesis as well as a clinical examination, and the physical symptoms and the individual character led me to the similar, the best fitting homeopathic medicine product. And at this situation, I told the horse owner, we have to do a full diagnostic now, because the horse could have a septic joint already, for example. But the horse owner said, I've spent so much money on this horse, I don't want to spend any more money on it. Either homeopathic treatment works or we have to euthanize him. And this is the situation where I have to say, or every veterinarian has to say, okay, but we have to monitor it really, really closely. She had to send me pictures and videos, and she had to give me a phone call every day in order to assure animal welfare. The horse received Silicea terra C30, once a day, 3 globules orally for 3 days. This is the repertorization, general malnutrition, because the horse had a history of malnutrition. General's emaciation, appetite with emaciation. The horse was in a real bad condition. General's indurations, inflammation after, and general's wound suppurating. And Silicea terra is the only homeopathic medicine product which covers all rubrics. At the left side, you see the picture taken 10 days after the constitutional homeopathic treatment. There's no seroma, no edema, no necrosis anymore, just wound healing. The horse gained weight. And the most important point is that there was no lameness from the first day the constitutional homeopathic treatment started. This is the most important point for the horse, for animal welfare. At the right side, you see the picture taken 5 weeks after the constitutional homeopathic treatment, just wound healing, and the horse had gained more weight than it had had before. He was in a really, really good condition. The horse owner said it's the best condition ever, and the horse went back to sports and had no relapses. So cooperation between clinics and experts in homeopathy are in our responsibility towards our patients. The EU Commission in the European One Health Action Plan against AMR demands research in the field of integrative medicine. They are asking for alternatives. The WHO, in its strategy paper, Traditional Medicine Strategy 2014 to 2023, demands inclusion of integrative medicine in the respective national healthcare systems. You might know the care guideline, which leads us to do high quality case reports. And there is the home case care extension checklist, where the items specific for homeopathic case reports are marked in yellow now. Within the clinical findings, it's clinical history detail, which means that we have to describe the symptoms which lead us to the homeopathic medicine product in detail. Therapeutic intervention, there we have to describe the type of homeopathy used, if it's individualized homeopathy or isopathy or whatever. And we have to describe the medication in detail. We have to give nomenclature, manufacture, potency, scale, and galenic form. Within follow-up and outcomes, what's really important, especially for homeopathic case reports, is that you have objective evidence like X-rays, pictures, blood work, fever, everything which is objective. We have to describe the occurrence of homeopathic aggravation, and we have to describe, assess, and discuss a possible causal attribution of changes. And for this, we have the so-called modified Naranjo criteria or Monarch criteria. And I now invite you to answer these questions together with me. You will get these questions in a poll, and you have 15 seconds to decide if you want to say yes or no, or not sure. But it's not a hurry. I will just read the question, and then you will have to decide if it's a yes or a no, or not sure. And at the end, we will count the points, and we will evaluate if there is an association between the administration of the homeopathic medicine product and the healing of the patient probable. So yeah, and in the first question, if there was an improvement in the main symptom or condition for which the homeopathic medicine was prescribed, we all agree yes, so it's 2 points for question 1. Question 2, that's the same. did the clinical improvement occur within a plausible time frame relative to the medicine intake? Yes, we all agree on this, because the horse was no longer lame from the first day on. So it's a really immediate reaction on the homeopathic medicine. So it's 3 points. Was there a homeopathic aggravation of symptoms? I did not see a homeopathic aggravation. The majority said no. Yeah, so I think we have to say that there is no homeopathic aggravation, no points, so we are still on 3 points. Question 4, did the effect encompass more than the main symptom or condition? Were other symptoms not related to the main presenting complaint improved or changed? The majority says yes, I agree with this, because the horse had gained more weight than it had ever had before, and he was always in kind of a bad condition because maybe of the malnutrition in the history, which was when he was a foal. But the horse owner told me that she always tried to feed him with more or less everything, but he didn't gain weight really good. So for this, at this time, he just received hay, and that's it. And he got really, really in a good condition. So for question 4, it's 1 point. So now we have 4 points. Question 5, did overall well-being improve? Yes, we all agree on this. So it's 5 points. Direction of cure, and now change to the next picture. Question 6 is 6A and 6B are interchangeable. And we take 6A, direction of cure, did some symptoms improve in the opposite order of the development of the symptoms of the disease? Many say not sure. Several people say yes. I agree with them who say yes, because the horse became lame at the latest, just the day before the horse owner called me, and the lameness vanished first. So I would say yes, so it's 6 points for the moment. Question 7, did old symptoms reappear temporarily during the course of the improvement? We have to say no, there were no old symptoms. So it's 0 point for question 7. Question 8, are there alternative causes other than the medicine that with a high probability could have produced the improvement? The majority says no, I agree with this, because the horse had been taken off medication already 6 days before, and the horse owner did not do any other medical treatment. So it's 2 points for question 8. And question 9, no, 1 point for question 8. And question 9, was the health improvement confirmed by any objective evidence? That's really important. The majority says yes, because there were pictures taken. So it's 2 points for question 9. We now have 9 points. And question 10, did repeat dosing, if conducted, create similar clinical improvement? It is to say that the horse did not get any repeat dosing. This means that the horse, for example, would have needed the homeopathic medicine or product, for example, 2 or 4 weeks later because of some recurrent symptoms. But he did not need any repeated dosing. So this is no. We have 9 points. And the publication says that results should be more than 8 points for chronic cases and more than 6 points for acute cases, in order to be able to say that there is an association between the homeopathic medicinal product administration and the healing of the patient, probable. We have 9 points, so the association of the administration of the homeopathic medicinal product and the healing of the patient is probable in this case. And it's, I think, really important to include this assessment by Monarch criteria in every homeopathic case report. So, to come to a conclusion, the One Health approach needs integrative medicine and the other way around. Integration of integrative medicine at universities in teaching and research is in the sense of the patients, in the sense of the One Health Action Plan of the EU Commission and the WHO Traditional Medicine Strategy 2014 to 2023. Evidence-based integrative veterinary and human medicine is forward-looking in terms of One Health. The One Health approach needs to be integrated at all levels of scientific and daily practice work. We as an interdisciplinary team need to transform the spirit of One Health into reality so that homeopathy can be a pioneer with regard to this. So One Health involves everyone. It's about collaborating, communicating, and coordinating, and working together is key to One Health. These are the references. Thank you for your attention, and I'm looking forward to questions. Thank you very much.
Thank you, Petra, and that's wonderful. Does anyone have any questions? Nobody's sent me any yet. In the meantime, I've got a little list of questions really, but if I could, a simple one first of all, Petra. You mentioned Keller on mastitis in the veterinary record. What was the defect in the principles that they used when you said they didn't stick to homeopathic principles?
The problem was that we found out that they did not integrate any experts in homeopathy in their research team. We tried several times also from the University of Veterinary Medicines in Vienna, because we have a professor working there who is professor for pharmacology, but she's really into the homeopathic topic. And she offered to try to get in contact with Professor Sundrum, but no chance to get in contact. They just describe in this study that they used a repertorization tool, but they do not describe it in detail. They just said that they did a first or a restriction to several homeopathic medicinal products, but we do not know which symptoms were taken for choosing the homeopathic medicines. Further to this, they say they had just some minutes during the milking process to find out about the homeopathic medicinal product. So we get some hints what they did, but we do not know anything about the repertorization program used, nor which symptoms. It's not described. And we know that there were no experts in homeopathy. And I think even for really experts in homeopathy, it's very difficult to have just some minutes to choose the right homeopathic medicinal product in case of mastitis in cows. So right. It's not doable.
Thank you. Am I right in thinking that there isn't any evidence that they actually compared the remedies to the materia medica as well? They just went on the repertorization.
I have to have a look. I think they mentioned materia medica, but they they gave a wrong definition. If I remember it right, we wrote a statement, we wrote a letter to the editor of Veterinary Record, but we got refused with the words that Veterinary Record accepts Western medicine only.
Right.
That's all to say, I think.
Yeah. So thank you. We'll leave it at that. Another question then on the integration of veterinary medicine and medicine. In fact, this was a question to Thomas as well as Petra. That you talk about the integration of veterinary homeopathy and homeopathy into universities. And I wonder if you have an overview of how successful that is particularly in the EU, because you'll be aware that our universities here are staunchly opposed to homeopathy, and in fact we have one report of a lecture being given in one university where homeopathy was actually ridiculed and laughed at. So the prospect of integrating homeopathy into any university in the UK is fairly slim. But my feeling is that that's just a sign that homeopathy in the UK is veterinary homeopathy is sort of behind the times. Could you give us an overview of what's happening in the EU on the medical and veterinary side?
It's behind the times. It's I fully agree with what you said. As best practice example, we have Switzerland, where it is taught at the universities, medical and veterinarian, but it's only some, for example, the university in Belfast, Medical University. I had the chance to be part of the teaching team there, and they have a full obligatory lecture for students, medical students. It's led by Professor Ennis, Madeleine Ennis, and it's a full program with scientific part, with description of the methodology. It's really a great schedule, and it's definitely needed to be included in the other universities as well, and especially for veterinary homeopathy, because it's really a legal request. And we've got the information from a lawyer that in case at an organic farm, if the veterinarian is not able to treat with homeopathy because he doesn't know anything about it, the farmer could make it I don't know how to say in English, a legal request or Anzeige. Thomas, do you know the word Anzeige in English?
Anzeige in which context?
Eine rechtliche Anzeige.
A sue, lawsuit.
Okay. So the farmer could make a lawsuit in this case. So this is the legal situation we are in. So universities should better integrate it. That's what I have to say, but reality is different from what it should be. But in the sense of One Health, it's even more important in the sense of antimicrobial resistance. Thomas, do you want something to add from the medical side?
I think the situation is difficult. Speaking about Austria, I can say at my university, it's the medical faculty of the Johannes Kepler University in Linz. We had the opportunity to teach homeopathy as part of complementary medicine. Yes, but we also realized that there is sometimes a lot of pressure from different persons, institutions, for example, we had to due to the rector, yes, we had to withdraw one lecture because there was pressure from another university. Still within general medicine, we have complementary medicine, homeopathy, etc. Yes. From the university in Salzburg, surprisingly, we became an invitation to give a lecture about homeopathy 2 weeks ago. So it always depends on personal relations, yes. But our interest is to do research on academic research on a university level, and yes, this is our effort. And perhaps Peter, you can tell something about this kind of Stiftungsprofessur. These are chairs at the university paid by foundations, for example. So there are models in Germany, in Bavaria, and we also try to go this way. I think this is a feasible way to get at the university and to be able to do a proper good research there.
I absolutely agree with this, and I just forgot to say that at the University on Veterinary Medicines in Vienna, we have lectures on homeopathy, but unfortunately without ECTS points. But yeah, the possibility of a foundation professor on complementary medicine is a great chance, and we have had some of these in Switzerland and in Germany already, and maybe we have the chance in future to have one in Austria as well. But as Thomas said, it is all about personal relationships, to get into the universities, to speak with people, to let them know what the scientific evidence is. And if you tell them and if you give them the articles, the publications, some of them at least change their mind. They see the need, they see that especially patients and patient owners are really interested in, and yeah, it's the way forward, it's the way into the future. So we have to keep going and try to get into universities.
Thank you, Thomas. Does anyone else have questions? My chat box is empty. Gary.
Thank you. Hi, thank you, Petra. Yeah, I think I've just got a comment and a question. And I think the issue of antimicrobial resistance, it's such a huge issue, as you correctly said, that affects human and veterinary medicine and all of us actually. And it's a real ticking time bomb. I think there's been no new class of antibiotics developed since something like the 1970s or something like that. And we've all been, the world's all been focusing, I think, healthcare on non-communicable diseases and long-term chronic illness. And then all of a sudden, actually, the last 18 months have shown us that actually communicable infective issues are just as much a threat as ever. So yeah, I think this is a really important area. But I'm just thinking about the, I think you mentioned the EPI3 study in France, and that sort of arm of the EPI3 study that was in relation to upper respiratory tract infections and antibiotic use. And obviously, they looked at the group of practices, GPs that prescribe homeopathy within their practice, and then compared that with practices that don't prescribe homeopathy. and there was a significant reduction in antibiotic use and reduction in use of antipyretics, as you know. So anyway, getting to the point, my question is, do you know of any, are there any plans, or is there anything afoot to replicate that type of study, looking at, you know, practices, medical practices or veterinary practices, which integrate homeopathy versus those that don't integrate homeopathy, and comparing the use of antibiotics? Because my mind always goes to EP3 whenever I hear these discussions, and it strikes me as something that really would be, well, like a lot of our good previous work, it's just crying out to be replicated again, isn't it? So I just wondered, have you heard of any sort of plans to do that, or any discussions about that?
So for veterinary homeopathy, so thank you very much, and also thank you for giving the possibility to speak here at the Faculty of Homeopathy. And yes, there are some plans to do these replications, and I fully agree that we need them. For example, for veterinary homeopathy, we are now starting this project in farm animals, and we want to compare the use of antibiotics in farms, for example, turkey farms in Germany, which are treated with conventional medicine only, and on the other hand, treated with conventional medicine and homeopathy, in order to see if there is a reduction in antibiotic use. And for human medicine, there is to say that in Bavaria, there is lots of money put to a research on alternatives to antibiotic use. And I know that there are several applications also from the homeopathic side, because it's to complementary medicine as a whole discipline. But I know there are several applications for randomized controlled trials, but also for observational studies. But as far as I'm aware of, it's still not decided which study will be done. We will see, but it's a first step, and it's a very, very important step that even governments sees the need that such studies are performed on a high standard at the universities. Thomas, do you know any other research projects?
I just thought about it. You know, this there is this group about Eric Barr, but no specific group with. I'm not aware of any prospective study. Yeah, there have been done several retrospective studies, for example, from the research group in Tuscany. Yeah, and they are still working on this issue. No.
That was a point. The project of Eric Barr's, the actual running project. We had just the first meeting, and one of the topics of this project is to decide or to prioritize, to decide which studies need to be done first, because this is the most important thing, because we have not much capacities, and we have to focus on the most important indications and on the replications of the study, because this is a big problem we have in homeopathy, that we have more or less no replications of studies done.
Thank you. As often happens in these situations, we're getting on in time, and at the last moment we've got a flood of questions. So well, quickly I can deal with it. Well, I'll let you, Petra, deal with it. A general question: are homeopathic aggravations also observed in animals, or is this less common compared to humans?
Sorry, I did not.
Sorry, are homeopathic aggravations seen in animals? Are they more or less common than seen in humans?
I can say that homeopathic aggravations are seen in animals for sure, but I can't compare it to to human medicine because I have no experience with treating humans. But I can say yes, they are there.
What contribution can homeopathic, I'll put these two questions together. What contribution can homeopathic vets in general or referral practices make? How are clinical experience gathered? Is there currently a database that homeopaths can register their cases in?
Homeopathic veterinarians can do a lot. They have to do a lot, definitely. Regarding database, we have the offer of Clifico, which is a database which now collects case reports in human homeopathy, especially COVID-19, concerning COVID-19 cases. But Tiziana Di Gambierti offers that we as veterinarians could get in contact with Carlo Rezzano, who is dealing with Clifico, and we can start on this project to have a database which is connected with the RADA repertorization program. And yeah, it's somebody who takes over on this big project, but the offer is there, and I can make contact with Tiziana. She's the coordinator of the research subcommittee of the European Committee for Homeopathy.
Okay. Would cost effectiveness studies be possible in the veterinary husbandry setting?
We are just looking into this question. We want to evaluate cost effectiveness also in our observational study in farm animals. It's for the moment it's not 100% clear if this is feasible, but we have the plan to include or to evaluate cost effectiveness together with effectiveness.
Right. There was a trial done in India, I think, wasn't there, on mastitis that showed huge cost effectiveness. There's a side to that. Sorry, I've got a message here. Karen Seerstead would like to ask a question. I can't find you, Karen, on my...
I can say it. Yeah. So I represent Whole Health Agriculture, which is sort of the continuation of homeopathy at valley level that has been educating farmers in using homeopathy for 20 years in this country, in England. And we recently did a survey with 221 farmers, and it's being released before the summer, I hope. But I wrote an article for the ARH journal that was released on Friday. So I'm willing to send you that. Because what makes us different is that we actually regard the farmers as the experts. The farmers who've done the training, homeopathy at valley level training or similar. And so when we collected all the data from the farmers and their successes on reducing antibiotics and so on, the homeopathy scores top for all diagnosis or everything. So it's actually and we also have some fantastic quotes from the farmers who so we are not the scientific part of the research, but we represent the farmer's voice more and the clinical experience. And we also found that actually the farmers are the best homeopaths you can find, because they use it 365, they use it all day and all night sometimes. So we have a lot of data that we would like, and also my colleagues left, Chris Auckland, who's a vet, had to leave, but and also Jackie Pierce-Dickens, who's our CEO, but we would wonder whether we could have a copy of your presentations, Petra. And also we are able to provide you with 1 or 2 pig farms in East Anglia and connect with our vets if you are interested. So, yeah.
Yeah, that's very good to hear. Thank you very much. And you mentioned a really, really important point, namely the farmer's voice. This is the strongest voice we have, because those are the ones who are listened to, especially from the political side. have to disagree a little bit on the point regarding that the farmers are the best homeopath, especially because I'm from Austria, and in Austria it's not allowed that non-veterinarians treat animals with homeopathy. It's the same for human beings. So that's a kind of a difficult situation for me in Austria, although I know that there are several, so to say, lay practitioners who do a really, really good job. But I think it's really interesting to see in several studies, and I can send these studies, that farmers, although they are trained in homeopathy and they use homeopathy every day, as you say, they are asking for veterinary support because they don't find the right remedy, the stimuli, in every case. And I think this is really the important thing, to have this kind of teamwork between the farmers who know the animal best, for sure, and they see every kind of changes, and they see really, really early symptoms. And this is all it is about. We have to look at our animals really closely and see the early symptoms. That's easier to treat, especially in really upcoming dangerous diseases. And this is the teamwork. To come back to the teamwork point, it's really important that we work together, the farmers and the veterinarians, and the veterinarians need to be trained in homeopathy, otherwise the farmers don't accept them at all. And that's our responsibility, to get the veterinarians trained, because the difference between farmers and veterinarians is that we veterinarians could, in case conventional therapy is needed, also give the conventional treatment. And this is something which is, I think, really, really important, to get diagnosis first and then work together on the decision how to treat the animal best. First with homeopathy, but in case it doesn't work, or it needs a surgery or whatever, then conventional medicine is to be given as well. Yeah, so I'm looking forward to your results, and for sure I can give you the presentation. And yeah, it would be really, really interesting to get in contact regarding the pig farms, to see if we can do the study there. Would be wonderful. Thank you.
Thank you, Petra. Just a comment on Hall. Chris Auckland was in the conference. I'm not sure whether he still is, but I was going to ask if you'd like to put a mention about HAWL, Homeopathic Weller Level, which is the organisation that teaches farmers how to use homeopathy themselves. But I would add that with HAWL, they are adamant that they haven't got enough vets to support the farmers, and wherever there are vets, I know Chris Auckland does a huge amount of work with them, and we have homeopathic vets around the country that are supporting. Here he is, Chris. Comment, please, Chris.
Oops, hang on. I'm unmuted. Yes, fantastic. Yeah, comment. True. That the whole emphasis of homeopathic Weller Level, and then the other organisation, Whole Health Agriculture, is about empowering the farmer to do well with it. And as we just had from Petra, I think it is important we have that veterinary input, that ability to recognise there can be this top level where things go really wrong, and we as veterinary professionals have the capacity to do that. For any homeopathic vets out there interested in being involved in teaching, get in contact with me. I'm happy to share what I've been doing the last couple of decades. It's often low-level homeopathy. It's not like complex, fantastic sort of, Sankren level prescribing. A lot of it's real basic stuff, but let's face it, on farms, we often are dealing with just basic stuff. So if anyone has a little bit of enthusiasm to do a bit of teaching and a bit of, cajoling and supporting farmers to get these basics working well, That's what makes a difference. And what we definitely see that it is by getting these simple things sorted out well and getting the methodology in place, that saves things escalating to the point where they need that veterinary input so often. And while things like these narrow research projects for one particular remedy, one particular disease problem, one particular species is great, the way that we see it, it's that whole homeopathic approach. So it's a fun, holistic approach. And farmers are amazing. Farmers are amazing in what they do. More than anyone, they are in charge of their patients 24/7, 365 days a year, and they're observing all the time. Even the best homeopath never does that. Even the best vet or doctor never does that. We have them for a narrow bit, and then we see them and we prescribe and we go away again. Farmers get a chance to seal the whole thing. So if you're working with farmers at all, you get to experience that as a process, which is great. So yeah, contact me. I'm going to have to go from this. I've really enjoyed what I've heard. And so, yeah, get in contact with me or Karen or Jackie at all, and we can tell you more, or Chris Lees directly to the hall, tell you more about what goes on. Thanks, guys.
Thanks, Chris. Fine. Yeah, and I should point out as well that, you know, from the faculty point of view, if you want to become a member of the veterinary member of the faculty, you do have to learn about farm animals as well. So we are doing our best to supply that niche, but there is without doubt, there's a real dearth of trained homeopathic vets that have contact and experience in large animals and farm animals. But we're all doing our best anyway to fill that. Fine, unless there are any other burning questions, this is the point where I say if you go away and think, oh, I wish I could have asked that question and got that bit of information and didn't get it, then I'm afraid that's your responsibility. Thank you very much, Petra. Just an amazing piece of work and a brilliant session. And we'll all go away far better informed and hopefully inspired as well. Thank you everyone for their participation. Thank you to Ali, our communications officer, who's sitting there loyally listening to us and letting people in and out. Once again, thanks very much to Freemans and Saltire for sponsoring this. Have a look at the Saltire website in particular. So some great books on there. Vermeulen, David Lilly, just some brilliant books, and Freemans, of course. Thank you. If you'd like to join, if you're not a member of the faculty, if you're a statutorily registered professional in any country, then you are very welcome. So get in touch on the website, and we all look forward to the next session of CPD, veterinary CPD. Again, it will be actually mixed veterinary and medical, but we claim Jeff Johnson as a vet from his first interest in homeopathy. He does a lot with humans as well, and he'll be reminding some people and introducing others to the lanthanides, which is very exciting. So thank you, Petra. Thank you, Thomas, for being here in support, and I wish everybody a good, if not sunny, weekend. Thank you.
Thank you very much. Goodbye.